So good afternoon everyone. So today my topic is bones of the hand. So basically these are the bones which are present in our hand. You can see now, last bench.
Yes.
Okay. So these are the carpal bones, these are the metacarpal bones, and these are the phalanges. Okay. So can you tell how many carpal bones are there in our body? 8. 8 in one hand. Okay. So this is the proximal, you know proximal distal? So this is the proximal row and this is the distal row. Okay. So there is one mnemonic to remember the names of the carpal bone. The mnemonic is she looks too pretty, try to catch her. Okay, the first letter of each words. You can write it if you want. So can anyone name the bones in proximal row? Anyone? Yes? Yes, stand up. In proximal row, what are the bones present? Can you name?
All the bones.
Yeah, in proximal row. Okay, name all the carpal bones.
Scaphoid, trapezoid, trapezius, capitate, hamate, lumate, pisiform, tripura.
Okay, but you haven't tell it in a sequence. You have to tell it in a sequence, okay? Like in proximal row, if you follow the mnemonic, it is scaphoid, it is lunate, it is triquetral, and it is pisiform, okay? And in the distal row, trapezium, trapezoid, capitate, and hamate. Okay, I will pass the bone later, you can appreciate it. So they will not give single bones in the exam, they will give this entire hand and they will ask you to name the bones, carpal bones, okay, in a sequence. So as you can see here also, it is scaphoid, lunate, triquetral, pisiform, then trapezium, trapezoid, capitate, and hamate, okay. These are the metacarpals, 5 metacarpals. We usually we name it from lateral side, okay. Lateral side means towards the thumb. We go from lateral to medial. So from lateral we start here. Even the metacarpals we number it from lateral to medial. There are first 5 metacarpals. It is the first one, it is the second, third, fourth, and fifth. Okay. Am I too fast? Okay. So here also you can appreciate it in a better way. This is the scaphoid, lunate, triquetral, pisiform. Then again from lateral side, okay. Trapezium, trapezoid, capitate, and hamate. And this is the palmar surface, okay. This is the palmar surface where you will get the pisiform bone, and this is the dorsal surface. Clear? This is the palmar surface and this is the dorsal surface. If you are not able to understand anything, you can tell me. Okay, I will explain again. So you can write it. There are 8 carpal bones arranged in 2 rows, proximal and distal. Proximal from lateral to medial, scaphoid, lunate, triquetral, pisiform, and in the distal row, this is this one. From lateral to medial, trapezium, trapezoid, capitate, and hamate.
On the palmar surface, is the pisiform on top of the triquetral?
Yes. On the distal part of the triquetral, there will be pisiform. And now I will describe each of the bones, okay? So first, scaphoid. So this is the scaphoid bone, okay? You can see that it is boat shaped. Now there are various articular surfaces through which scaphoid will articulate with rest of the bones. Like in the proximal part, it is having a convex articular surface through which it is articulating with the radius. You have been taught radius, na? So you can see there is one articular surface through which it is articulating with the radius. You can see here also. See, scaphoid, it is having an articular surface here through which it will articulate with the radius. Now, you know this is the lateral side and this is the medial side. Okay, so can you tell scaphoid is articulating on the medial side with which 2 bones? Anyone? It's written over here. This is the medial side of the scaphoid and lunate. Okay, it is having 2 articular surface. One is for capitate, another is for lunate. And distally, it is articulating with Trapezium and trapezoid, yes. And it is also having a tubercle here. You will also recognize the palmar surface by the tubercle. Okay, tubercle of the scaphoid, somewhat here it's located. So yes, next bone is lunate. Now this is the lunate bone. It is lunar, means crescent in shape. Similarly, you can tell it from here also, the articular surfaces. This is the lunate. So medially it will articulate with triquetral, yes, and hamate, and laterally scaphoid. Proximally radius, yes, radius, and distally capital. Clear? You can tell the articular surfaces by remembering the picture. You don't need to mug up or something. If you remember the picture, you will be able to tell. Next is triquetral. This is triquetral, okay? This is the triquetral bone below the pisiform. So it is roughly cuboidal in shape. Okay, so again, laterally it is articulating with lunate. Medially it does not articulate with anything. But on its palmar surface, it is having an facet for pisiform. Clear? You know now, this is the palmar surface, okay? This is the palmar surface, this is the dorsal surface. Okay? Okay. Then next bone is your pisiform. Okay, it's very important. Pisiform. So anyone can tell what is a sesamoid bone?
The bone which develops in tendon or muscle.
Yes, it develops in tendon. Okay. So there are some peculiarities of pisiform bone. It's the smallest carpal bone. Okay. And as you can see, it develops in the tendon of flexor carpi ulnaris. You have seen flexor carpi ulnaris in your dissection hall. It's been shown, na? So it develops in the tendon of flexor carpi ulnaris. And you can see this proximal row and radius and ulna, these all are taking part in the formation of wrist joint, except this pisiform bone. It is not taking part, it's away from the wrist joint, as you can see here. So proximal carpal take part in formation of wrist joint except the pisiform bone. Okay, and these carpal bones are also joined with each other and form the intercarpal joint. So yes, do not take part in the formation of wrist joint. It lacks periosteum, that is a covering of bone, and it is the last carpal bone to develop. Okay, you might be asked about the ossification center. I will explain it later. It develops by 12th year. It is the last bone to ossify. Okay. So yes, so again dorsally it is having an articular surface for triquetral. You are getting now? See, this is the triquetrum. Above it is the pisiform. On the this is the palmar surface of triquetrum. So it is having a facet for this pisiform. And then at the back of pisiform is the dorsal surface of pisiform, articular surface for this bone, triquetrum. Okay. Now you will be asked in exam about this. Sesamoid bone develops in the tendon of flexor carpi ulnaris, smallest carpal bone, peculiarities of pisiform bone. Okay. Now trapezium, trapezoid, capitate and hamate. Now this is the trapezium bone. Okay. You can see that it is the tubercle of the trapezium. Here, it is the trapezium bone. This is the tubercle of the trapezium. Okay, and you can see there is a deep groove medially. Okay. Then again the articular surfaces medially with trapezoid. Then distally base of the first metacarpal and proximally scaphoid. Okay. Now this is the trapezoid. This is the trapezoid bone. Okay. It is in the shape of a shoe. Okay, and articulates medially with capitate, laterally with trapezium, distally, yes, and proximally scaphoid. Clear? And this is the capitate bone. This is the capitate. Okay, this is the largest carpal bone. Okay, so it is a head. Head is in the proximal part, and it's a triangular base. Okay, which is in the distal part. And again, the articulations you know now how to tell articulations. Okay, and this is the hamate bone. You can see the hamate bone. This is the hamate bone. This is the hook of hamate, which is very important. The clinical correlation I will tell later to the hook of hamate is very important. Okay. So yes. So again, medially with the triquetral, laterally with capitate, distally with 4th metacarpal and 5th metacarpal, and proximally with lunate. Okay. Clear now? So now the ossification of carpal bones. Okay. So carpal bones develop from only one ossification center, which is the primary ossification center. Okay. Now these are the time within which the ossification center appears. Like capitate in 2nd month, hamate in 3rd month, triquetral in 3rd year, lunate is in 4th year, scaphoid 4th to 5th year, trapezium 4th to 5th year, trapezoid also same, and pisiform is the last bone, as I have said it earlier. Around 10th to 12th year it appears. Okay, if you want to write, you can write. We have 5 metacarpals. Okay, 1st, 2nd, 3rd, 4th, and 5th. Every metacarpal has a shaft. This is the shaft of the metacarpal. Okay, this is the proximal end of the metacarpal, and this is the distal end of the metacarpal. Okay, distal end is the head of the metacarpal. You can see head, globular head, and the proximal end is the base of the metacarpal. You can see last bench. Okay, so it has a medial surface, a lateral surface, and a dorsal surface. Okay. Now you can see the metacarpal bones are articulating or forming a joint with the distal row of the carpal bones. Clear? And also the 2nd, 3rd, 4th, and the 4th, 5th are forming joint between themselves. You can see. See here, this is the head. Okay, distal end is the head of the metacarpal. This is the base of the metacarpal. This is the shaft, medial surface, lateral surface, and behind is the dorsal surface. Clear? Now, little bit about each metacarpal. So, this is the first metacarpal. You can see that it is broad and thicker than the rest of the 4 metacarpals. You can see it is broad and thicker than this 4. And also it is very much mobile. As you can see, it's very mobile and also away from other 4 metacarpals. And here it has a saddle shaped facet for articulation with this bone. What is this bone? Trapezium. You can see here. Okay. See, it is articulating with the trapezium bone. Okay. Now this is the 2nd metacarpal. Okay. How will you identify it? It is having a groove here. You can see a groove. You can appreciate it like this. Groove. See, this is the groove. This one. Okay, so it's having a groove. This one is a groove. Okay, it is articulating with trapezoid. Then next is a 3rd metacarpal. Okay, 3rd metacarpal has a styloid process in its lateral and dorsal part. See, here is the styloid process. Styloid process. Okay, So again it is articulating with capitate. Next is fourth, articulating with the hamate, and fifth with the hamate and also with this fourth metacarpal, okay? And this fifth metacarpal on its palmar surface is also having this ridge, which is dividing it into lateral surface and medial surface, okay? Now ossification of metacarpal bone. So do you know what is primary ossification center, what is secondary ossification center? Anyone? Can you explain? One word.
From the primary ossification, the main part of the bone develops the shaft.
Prenatal. Yeah. Primary is prenatal.
Yeah, primary is prenatal.
Haan.
The secondary ossification center, it generally gives rise to the phalanges.
And it's postnatal.
Yeah, it's postnatal.
So, in case of metacarpals, the primary ossification center will appear in the shaft. Okay, and in case of first metacarpal, the secondary ossification center will appear in its base. Okay, but in case of rest of the metacarpal, the secondary ossification center will appear in its head. Okay, now this primary ossification center will appear around 9th week of intrauterine life, and secondary ossification center of this first metacarpal will appear around, anyone, 2nd to 3rd year. Okay, and it will join at around 16 years. Clear? And this also, the secondary ossification center of the rest of the metacarpus will appear around 2nd year and join by 16 to 18 years. Okay? So next is phalanges. Okay? So this 4, there are 3 parts of phalanges: proximal part, middle part and distal part. This is the proximal, middle and distal. But thumb has only 2 phalanges, proximal and distal. See, this is the proximal, middle and distal. Proximal, middle, distal. But thumb has only proximal and distal. Okay. See, it is a proximal phalanx, middle phalanx and distal phalanx. Okay. Now each of these parts has 3 parts. This is the head, this is the shaft and this is the base. Okay. See, here also head, shaft and base. Here also head, shaft and base. Clear? Now this base of the proximal phalanx, what is this shape? Concave. Okay, it has a concave articular surface to articulate with metacarpal. Okay, and the head of the proximal phalanx is pulley shaped. Pulley, P-U-L-L-E-Y, pulley shaped. Okay, and here also in case of middle phalanx, the base you can see there are 2 concavities. It will give space to the 2 convexities of the head of the proximal phalanx. Got it? And here this head also pulley shaped and it is irregular in shape of the head of the distal phalanx. So this is the entire phalanx. Clear? It is forming here metacarpophalangeal joint. And this is the proximal interphalangeal joint. This is the distal interphalangeal joint. This is the proximal interphalangeal joint. This is the distal interphalangeal joint. Okay? And this is the metacarpophalangeal joint. Now similarly ossification of phalanges. So again it will have a primary ossification center in the shaft. Okay, and so the primary center will appear first in the distal phalanx, next in the proximal phalanx and then at last in the middle phalanx. Okay, and the secondary ossification center will first appear in the proximal phalanx, then later in the middle and distal phalanges. Okay. Now, in the distal phalanx, the primary center will appear at around 8th week, in the proximal phalanx, 10th week, 8th week in the distal phalanx, 10th week in the proximal phalanx and 12th week in the middle phalanges. Okay, and here also same, 2nd year, 3rd or 4th year, then they will unite with the shaft between 16 to 18 years. on the skeleton of hand. What are the muscles attached? Okay. So anyone know which is the thinner region and which is the hypothinner region in the palm? Thinner and hypothinner region of the palm? Don't know. This is the thinner. This is the hypothinner. Okay. See. This is the thinner region. This is the hypothinner region. Now various muscles have been taught in while radius and ulna was taught, and their insertion was there in the bones of the hand. Do you remember? Okay. So can you tell what the pink dots represent, or what the pink color represents? Origin. And what is insertion? So there are various muscles which have been taught to you in case of radius and ulna, which are inserted here. Okay, just see the picture once and you will get it, or you can take picture. This one and this one. Taken. Previous one. So first of all, I will tell about thinner muscles. So this is the thinner eminence. Okay. So what are the muscles? First is abductor pollicis brevis. Okay. This one. Second is flexor pollicis brevis. Okay. Third is opponens pollicis. And fourth one is adductor pollicis. So learn now only. Okay. Flexor pollicis brevis, abductor pollicis brevis, opponens pollicis, and adductor pollicis. These are the muscles of thinner eminence, or the thinner muscles. So all the thinner muscles will be supplied by median nerve, except adductor pollicis, which will be supplied by ulnar nerve. Okay, you have seen median nerve and ulnar nerve in your dissection hall. Flexor pollicis brevis, abductor pollicis brevis, opponens pollicis, and adductor pollicis. Okay. See, adductor pollicis having two head. Okay. Flexor pollicis brevis is also having two head. It's not shown here, but it's having two head. So these are the origin and insertion. You can see here. See, opponens pollicis. You can learn the origin and insertion of the muscles from this picture. Have a picture memory in your brain, then it will be easier for you to learn the origin and insertion, as it's quite difficult to remember all the origin and insertion of the muscles. But if you remember the picture of the important muscles, then it will be easier for you. Like you can see here, opponens pollicis. You can easily, this is the origin. You can easily tell the name of the bone. Okay, and here, yes, there is flexor pollicis brevis. You can see the two head. You can tell the origin from the bone, from the name of the bone. Abductor pollicis brevis here. Okay, adductor pollicis here. It's inserted here. Here you can tell na from this picture the origin and insertion of the bone. Can you tell me the insertion of adductor pollicis from this picture? Anyone? You can try. It's okay if it's wrong. Anyone wants to try? Yes. So, abductor pollicis brevis, it's originating from the tubercle of scaphoid and proximal part of the tubercle of trapezium. So this is the tubercle of scaphoid and this is the tubercle of trapezium. Okay, so it's originating from here and it is inserted in the lateral side of the base of the proximal phalanx of the thumb. So this is the lateral side, this is the proximal phalanx. So lateral side of the base of the proximal phalanx of the thumb. Same opponent's pollicis, it is originating from middle of the tubercle of trapezium. From here, around middle of the tubercle of trapezium, and is getting inserted in the lateral part of the palmar surface of the shaft of the second metacarpal. Okay, this is the palmar surface, this is the second metacarpal, this is the shaft of the second metacarpal, palmar surface from the lateral side. Okay. Flexor pollicis brevis, as I said, it is having two heads, superficial head and a deep head. So superficial head will originate from distal part of the tubercle of trapezium. Okay, it's from the middle of the tubercle of trapezium, it is from the distal part of the tubercle of trapezium. Okay, and the deep head will originate from trapezoid and capitate. Trapezoid and capitate. Okay, and this will get inserted in the lateral side of the base of the proximal phalanx of thumb. Okay, this is the proximal phalanx. Of thumb. Adductor pollicis. Adductor pollicis supplied by ulnar nerve. And these three muscles are supplied by median nerve. Okay, all these muscles are supplied by median nerve and this is supplied by ulnar nerve. Okay, so it is having two head, oblique head and transverse head. Oblique head originates from bases of second and third metacarpus and capitate. Okay, and transverse head originates from distal 2/3 of the ridge separating the medial and lateral surface of third metacarpal, and it will get inserted in the medial side of the base of the proximal phalanx of thumb. If you can see here, you will find all the muscles and can tell from the bone from where it is originating. Okay, so learn this picture, it will help you, or like have a picture memory of it. Now, hypothenar muscles. So all the hypothenar muscles, there are three hypothenar muscles. All of these are supplied by ulnar nerve. Okay. So first is flexor digiti minimi brevis, abductor digiti minimi, and opponens digiti minimi. Okay. You can see flexor digiti minimi, abductor digiti minimi, and opponens. The sequence of the muscle you can see from here. Okay. Now again, see, flexor digiti minimi, okay, originating from hamate, hook of hamate, okay, opponens digiti minimi, hook of hamate, clear? And abductor digiti minimi, this is which bone? Pisiform bone. Okay. See, flexor digiti minimi, hook of hamate, inserted in the medial side of the base of proximal phalanx of finger. See, insertion, see here. Okay. Abductor digiti minimi, medial and distal part of pisiform. You have seen from pisiform it's originating and it's getting inserted in the medial side of base of proximal phalanx of finger. Okay. And last muscle, opponens digiti minimi, hook of hamate origin, and insertion is medial surface of fifth metacarpal. Okay, so all these muscles are supplied by ulnar nerve. Okay. Now there are interosseous muscles. So there are two types of interosseous muscle. First is palmar interosseous muscle and dorsal interosseous muscle. Okay. So there are 4 palmar interosseous muscle and 4 dorsal interosseous muscle. So here you can see these are the palmar interosseous muscle. So this muscle, as you can see, these are 4 in number. Again, we'll count from the lateral side or from the thumb side. Okay. So this is first palmar interosseous muscle, second, third and fourth. Okay. So as you can see, it is originating from which bone? These muscles? Metacarpal. Okay. It is originating from one metacarpal. This is from first metacarpal, second, you can see it's from fourth and fifth. So as you can see, the middle finger, no palmar interosseous muscle. Okay. So it is unipennate. Unipennate, you know, the arrangement of the fibers means it's in one side, it's fan shaped in one side, the shape of the fibers. Okay. And insertion is in the dorsal digital expansion. Do any one of you know what is dorsal digital expansion? What is this term? No, expansion of the extensor tendon. Okay, it will present dorsal to metacarpophalangeal joint and proximal phalanx. Okay, it is inserted there. The palmar interosseous muscle, all the palmar interosseous muscle are inserted in the dorsal digital expansion. Okay, now what is the function? Adduction, and nerve supply is by deep branch of ulnar nerve. Now when you will read palmar interosseous and dorsal interosseous together, we will confuse it. So there is one mnemonic which is PAD-DAB. PAD-DAB. So from PAD, palmar interosseous, adduction, and DAB, dorsal interosseous, abduction. Okay. So dorsal interosseous, now you'll understand. See the muscle, it is unipennate. Okay, and see the dorsal interosseous, it is bipennate. So origin from metacarpal, adjacent sides of both metacarpals. You can see the adjacent sides. Okay. Similarly, it is supplied by deep branch of ulnar nerve. Both the interosseous muscle, both palmar and dorsal interosseous muscle, will be supplied by deep branch of ulnar nerve. Okay. And its function is, as I have told now, abduction. You will remember from the mnemonic, right? So again, it's inserted in the dorsal digital expansion. If you want, you can write. We'll start numbering from the lateral side, okay? Now we have read about thinner muscles, hypothenar muscle, palmar interosseous, dorsal interosseous. Now last is lumbricals. These all are intrinsic muscles of hand, okay? These all. So lumbricals. Here are the lumbricals, okay? Again we'll start numbering from lateral side. This is the first, second, third, fourth. Okay, these are the lumbricals. Now first and second are unipennate, and third and fourth are bipennate. Clear? So these lumbricals take their origin from the tendon of flexor digitorum profundus. Okay. So what is the function of these lumbricals? Flexion at the metacarpophalangeal joint. Which is the metacarpophalangeal joint? This one. Flexion at the metacarpophalangeal joint and extension at the interphalangeal joint. Okay. So you can see nerve supply, the first two, okay, first two are supplied by median nerve and third and fourth are supplied by ulnar nerve. Okay. Thinner muscles are supplied by median nerve and adductor pollicis is by ulnar nerve. Hypothenar muscle supplied by ulnar nerve. Palmar interosseous, dorsal interosseous. Yes, deep branch of the ulnar nerve. And lumbricals is by first two by the median nerve and third and fourth by the ulnar nerve. Okay, we'll remember. Okay. So first lumbrical. Okay. So origin is from the lateral side of tendon of flexor digitorum profundus of index finger. You can see it takes origin from the tendon of flexor digitorum profundus. Okay. You can see this is the first lumbrical. So this is which finger? Index finger. It is which side of the index finger? Lateral side of the index finger. So lateral side of the tendon of flexor digitorum profundus of index finger. Okay. And it will be inserted in the lateral side of dorsal digital expansion of index finger. You can see it is inserted over here. Okay. So similarly, can anyone tell me what will be the origin for second lumbrical? Yes, lateral side of the tell.
The lateral side of the flexor digitorum profundus of the middle.
Yes. See, origin lateral side of the flexor digitorum profundus of middle finger. Okay. Insertion.
Lateral side of dorsal digital expansion of the
You know, you have understood now what is dorsal digital expansion. Can anyone tell what I have told? Anyone can try? I have told this. You may be wrong, you can tell, it's okay.
expansion of the tendon.
Extensor tendon, yes, expansion of the extensor tendon. Clear now? Expansion of the extensor tendon will form dorsal digital expansion. And now, as I said, third and fourth lumbrical will be bipennate. Okay, so third lumbrical origin will be from the adjacent sides of the profundus tendon for middle and ring finger. You can see middle finger and ring finger adjacent sides. Okay, and insertion lateral side of the dorsal digital expansion of ring finger. See. Okay. Now can you tell me for this fourth one? Origin. This is which finger? Ring finger. This is which finger? This is ring finger. This is little finger. Okay. Now this side is adjacent sides of the ring and the little finger. Okay. So it will originate from which tendon? It will originate from which tendon? Profundus tendon. So see, arises from adjacent sides of profundus tendon for ring and little finger. Okay, and insertion lateral side of dorsal digital expansion of little finger. You can see from here. So anyone can again tell me first lumbrical origin? You can try. Anyone can stand and try. You are getting now what I am saying? You can tell origin insertion. Is it clear? Okay, now clinical correlation. Anyone knows what is carpal tunnel syndrome? Anyone? Is it taught before? Not taught. Okay. So what happens? Our dorsal surface of the palm, medial and lateral surface will together form a convex shape. But the palmar surface will form a concave shape. Now see, if this is concave and something passes over it, it will form a tunnel. Okay. So inside this tunnel passes which nerve? Median nerve. Okay, so anything which will increase the pressure of the tunnel will compress median nerve. So this is known as carpal tunnel syndrome. Okay, it can be due to some arthritic changes or due to obesity or during childbirth. Okay, so it will compress the median nerve. Clear? Now anyone know, have you understood carpal tunnel syndrome? Can anyone explain me now what is carpal tunnel syndrome? Last bench, you. See, our dorsal surface, medial surface and lateral surface, it's what in the shape of a convex shape, and palmar surface is forming like a concave shape, and flexor retinaculum passes over it and it's converted into a tunnel. That's why the name is carpal tunnel. Okay, can anyone explain me? You can try. First time it may be wrong, it's completely fine. Okay, I will ask later, okay? Now, anyone knows what is avascular necrosis? What do you mean by this term, avascular necrosis? Yes, tell.
Somehow the epiphyseal or the bone leg, it gets injured, the epiphyseal artery, it is not able to pierce the epiphyseal fluid and get into the epiphysis and supply the blood.
Yes.
So in such case, the epiphysis leads to its dead man.
It's devoid of its blood supply.
It gets, it dies. That's
Yes.
avascular necrosis.
Yes, okay, sit down. So, avascular necrosis of scaphoid bone. Now, I will tell you. This is scaphoid. This is the waist of scaphoid. Waist. Okay. Now, this is the distal part. This is the proximal part. Now, how is the blood supply of scaphoid? The blood vessels run from distal part to proximal part. It runs from here distally to proximally. So obviously proximal part will have little bit of less blood supply. So it is the most commonly fractured bone, most commonly fractured carpal bone, this scaphoid bone. Okay. So the fracture commonly occurs in the waist of scaphoid. So waist of scaphoid. So what happens? The blood vessels get cut, which are passing from distal part to proximal part. So what happens? There is avascular necrosis of the proximal part of the bone. Got it? It is the mostly it gets fractured when you fall on an outstretched hand. Okay. So this is the waist. Blood supply passes from distal part to proximal part. Okay. So if there is fracture in the waist of the scaphoid, the blood supply gets disrupted and there is necrosis of this proximal part. Avascular means without blood. Okay. Avascular necrosis means death of the bone, death of that part of the bone. Okay. Now another thing I want to say. This is what? This hook of Hammett. So an important correlation to this is ulnar artery and ulnar nerve. Okay, so if this this hook of the Hammett is fractured, so there will be disruption of the ulnar artery and ulnar nerve. It will be asked. This hook of Hammett is very important. Okay, ulnar artery and ulnar nerve is related to this hook of Hammett. Okay, so the blood supply will be disrupted and all the muscles, all the sensations supplied by the ulnar nerve will also go. Clear? This is the hook of Hammett. Now scaphoid you have understood, avascular necrosis of scaphoid. Okay. Next is Dupuytren's ischemic contracture. Okay, do you know what is palmar aponeurosis? Yes, tell what is palmar aponeurosis?
It's a thick connective tissue formation.
It's what fascia? What's fascia it is? Deep fascia. It's a modification of deep fascia, palmar aponeurosis. Okay. So what happened? There is thickening and fibrosis of the palmar aponeurosis in this condition. You can see here, the palmar aponeurosis get thickened and fibrosed, due to which there is flexion deformity. The finger, especially the ring finger and the little finger, these are flexed. You can see here. Okay? It is due to thickening of the palmar aponeurosis. Okay? And what is a mallet finger? This is what phalanx? So what happened? The extensor tendon, as you can see, extensor tendon, it is getting avulsed or detached. Okay, so the person will not be able to extend the finger. You can see his finger is flexed. Okay, his finger is flexed, so the person will not be able to extend the finger. So this is known as mallet finger.
Is the ischemic contracture needed?
Yes, if we need to cut the pulmonary aponeurosis, surgical. Okay. You got all these four? Can you tell me the nerve related to hook of hamate? Ulnar nerve. Okay. Anyone can explain the avascular necrosis of scaphoid? Okay. Can take this bone and explain?
What was the name of the guy that supplies to the scaphoid? What the name of the guy?
No, there are many arteries. Na? From distal to proximal it goes.
This is the artery, it enters the.
You can tell loudly so that everyone can listen.
So this is the scaphoid bone. The artery enters from.
Everyone listen to him, please.
This is the scaphoid bone. So the artery enters the bone from the dorsal.
Distal and
Distal end and goes towards the
proximal end. Yes.
So if there is an injury when in the outstretched hand, if there is an injury in the shaft region,
Waist region.
yeah, in the
Waist region.
the artery that is supplying to the proximal end, the path also
Gets disrupted. Yes.
So it is not able to supply to the proximal end.
Yes.
It leads to it there.
Okay. Good. Third and fourth finger, ring and little finger. Okay. Mallet finger, what happens? The extensor tendon get break or avulsed. Okay, due to which obviously if extensor tendon will go, person will not be able to extend his finger. No, so it remain flexed. You can see here, it's flexed.